Martin. I'm going to be your nurse today. Today we're going to be doing a head-to-toe assessment to check some things out. Is that okay with you?
Yeah.
All right. Can you tell me your name and date of birth?
Wade Martin, October 17th, 2003.
Okay, Wade. Can you tell me what day it is today?
Friday.
All right. Can you tell me where we're at right now?
My house.
Okay, that's great. The patient is alert and oriented ×3. His general appearance seems calm and compliant. All right, Wade, so I'm going to go ahead and start off by doing a little assessment here. I'm just going to look at your face, and before we start, I'm going to let you know that I did wash my hands, okay? Okay, so if you can just take a look at me here. All right, your eyes are symmetrical, eyebrows are full and symmetrical, nose is midline, skin seems tan, no apparent lesions, lips are pink and symmetrical. All right, now I'm going to let you look into this pen light, okay? Just look straight ahead for me. Okay. All right. Pupils both constrict to light, which is a good thing. Now I'm going to test accommodation. If you can just take a look at this pen light for me and follow it, okay? Okay. Pupils do constrict with accommodation, which is great. Now I'm just going to hold this up and test the size of your pupils. All right. They are about a 4 bilaterally. They are symmetrical. Now real quick, I want to take a look at your ears, okay? So your ears look symmetrical and rounded. The skin is tan, no apparent lesions or drainage on either side. Okay, now real quick, I want to take a look in your mouth, okay? Can you open up? All right, great. The oral mucosa is pink and moist. The tongue is pink and moist. Can you say ah for me? All right. The uvula rises midline, which is a good thing. Now can you stick your tongue out for me and raise it up? Raise it up, please. All right, great. So everything in there looks great. Can you smile real quick? All right, teeth are white. Open up. All right, no apparent cavities, maybe a little bleeding in the back. Okay. All right, now real quick, I'm gonna take a look. I'm just gonna feel around your neck, okay? All right, can you sit up for me? Thank you. All right, your trachea is midline. That's normal. Now real quick, I'm gonna check your carotid pulses, okay? All right, they are both present. They're about a 2+ or 3+ bilaterally, which is great. All right, wait, now before we continue, I am going to check your blood pressure, okay? I'm gonna have you lay your arm on this pillow so that it's about at heart level. There we go. Perfect. All right, I'm just gonna feel for your brachial pulse here so I can find where to put my stethoscope. There we go. I'm gonna pump it up real quick, okay? Okay, and it was about 130/80. All right, now we're gonna go ahead and take this off. All right, now I'm gonna go ahead with my assessment and check your arms, okay? Can you hold your arms out for me? Great, I'm just gonna feel the skin on them. It is tan, smooth, and dry, warm as well. Can you roll them over for me? Thank you. That is on both sides. I'll roll back over. I'm just gonna take a look at your hands. All right, your nails are pink. They are attached to the nail bed. They are smooth and rounded. No signs of clubbing. Okay, can you squeeze my fingers real quick? All right, hand strength is about a 5+ bilaterally. Okay. All right, now I'm gonna take a look at your hands one more time and I'm gonna squeeze on your fingernail, okay? Can I see both of them, please? All right, so capillary refill time is about less than 2 seconds. Now real quick, while you're in this position, I'm just gonna check about the size of your torso here. Can you lay your arms down for me? There we go, sit straight up. So I'm just gonna check this size right here, and make sure that AP is less than the transverse, okay? Which it is, and that's a great thing. All right, now while you're in this position, I'm gonna pull up this blanket, if you don't mind, and I'm gonna check out your legs, okay? All right. All right, so the skin of the legs is tan, smooth, warm, and dry on both sides. All right, now I'm just gonna feel on your feet real quick for your pedal pulses. They are equal bilaterally here. Okay, and I would grade them at about a 2 or 3 plus, about a 2 plus, okay? Toenails are rounded, nails are attached to nail beds, okay? Now if you want to just lay down real quick for me, you can cover up with the blanket if you'd like. All right, now I want you to push down on my hands. Okay, great. So that was just testing your plantar flexion. I would rate it at about a 5 plus, okay? All right, now I'm just gonna wash my hands real quick. All right, and real quick while you're in this position, I'm going to check on your legs for pretibial edema. I'm just checking for some swelling, okay? And I do not see any present. All right, now do you want to sit back up for me, please? Okay, and I'm also going to go back. I had forgotten to check your radial pulses. If you'll hold your arms out for me. Okay. All right, and your radial pulses are symmetrical, which is great. I would rate them at about a 2 or 3 plus, okay? Okay, wait, now that we're done with that, I'm going to check some of your internal organs, okay? So I'm just going to listen to your lungs and your heart and your belly, okay? All right, so first of all, if you'll just sit up for me. There we go. I'm just going to pull this tight so I can see your chest, and I want you to take a deep breath. Okay, chest rise and fall is symmetrical. I didn't see any heaves and lifts. All right. Now I'm going to go ahead and listen to your breath sounds, okay? I'm going to listen to a few of them here on the front, and then I'm going to listen to the back as well. Can you take a deep breath? All right, again. All right, again. Okay, again. All right. And I'll lift up your shirt now if you don't mind, and you can stay covered up with this blanket if you'd like to, okay? All right. Can you lift your shirt up for me? Thank you. All right. Can you breathe again? And again? And again? And again? All right. Wonderful. Great. Now you can pull it back down. Now if you can just swing over this way just a little bit, I'm going to listen to the breath sounds from the back, okay? Now I'm going to go in from the top and listen to them. Okay, can you breathe in? Okay, again. Okay, again. Okay, again. All right, now I'm going to lift up your shirt and listen to a few more. All right, can you breathe in? Again. Again. And again. Okay, and I'm also going to listen to one over here on your right side. Can you breathe in? Okay, wonderful. I didn't hear any abnormal breath sounds, nothing like wheezing or bronchi. Everything sounded clear and regular. All right, and the predominant sound that I did hear was vesicular throughout the lung, okay? So real quick, I am going to also listen to your heart. I'm going to listen to some of your heart sounds. All right, so I'm going to start over here. I'm going to feel for the second intercostal space on the right side of your sternum, okay? This right here would be the aortic. All right, and I'm going to go to the left sternal border at the second intercostal space and listen to the pulmonic side, okay? Great. Now I'm going to slide down to the third intercostal space on the same side and listen to Erb's point. Okay. Now I'm also going to need you to lift your shirt up a little bit for these next two sides, okay? That's great. Now I'm going to feel for the fifth intercostal space here, right by the sternal border. That's going to be the tricuspid area. And now I'm going to go to the mid-clavicular line of the fifth intercostal space and listen to the mitral area, okay? And I'm going to stay here for about a minute, okay, and count this. Okay, so I listened for a full minute. I didn't hear any abnormal sounds, and your heart rate right there at the mitral area was 82, okay? All right, I heard S1 and S2 sounds very clearly. I didn't hear any heart murmurs or any adventitious sounds. This stethoscope right here does not have a bell on it. My stethoscope with a bell I've left at work. This is the only one I had at home to perform this with, but if I did have my other stethoscope, I would listen to the 5 sites of the heart again with the bell and listen for the same sounds and adventitious sounds. All right, Wade, we're going to continue with the assessment now. If you don't mind to lay down for me real quick. All right, and I'm just going to go ahead and cover you up for some privacy. All right, now I'm going to listen to your belly real quick, okay? Okay, so I'm just going to listen to these 4 quadrants of your belly. Okay, there is normal active bowel sounds present in all 4 quadrants of the abdomen. Real quick, I'm also going to press down. I'm actually going to take a look real quick, inspection. I don't see any peristalsis or any abnormal movings of the stomach whenever I look, no heaves or lifts. Okay, so I'm just going to press down with one hand. I want you to tell me if there's any tenderness, okay? Any tenderness? Okay, I don't feel any masses, no lesions are present. I didn't feel any irregularities. I'm also going to press down with 2 hands now a little harder. I want you to let me know if there's any tenderness. Okay, any tenderness? Okay, I didn't feel any irregularities, no masses, no guarding with either one, and I didn't feel any organ enlargement. Okay, Wade, can you go ahead and stand up for me? All right, now real quick, I forgot to check some skin turgor. I'm just going to pinch real quick here to check for a brisk. Okay, so it snaps back really brisk, which means you are not dehydrated. It's a good thing. Okay, now also real quick, I want you to stand up and turn around. I'm going to check your spine, okay? Okay. Spine is midline. I'm going to pull your shirt up real quick, and can you bend over like you're touching your toes so I can check for scoliosis? Okay, so the spine is still straight. No signs of scoliosis, lordosis, kyphosis, any abnormalities. So you can go ahead and stand back up. Okay, you can sit down for me. Okay, and one thing that I had forgot, I'm going to recheck your eyes real quick, okay? I'm going to look real quick just at the color. The sclera is white and clear. It's clear there. The corneas are symmetrical and clear. Can you pull your eyes down real quick just so I can see the pink parts inside? All right, the conjunctiva is pink and moist. No abnormalities are seen. All right, Wade, I think that concludes our assessment. Is there anything else I can help you with today? Do you have any questions? All right, great. I think that concludes our head-to-toe assessment.